Welcome again. All right, now we'll do some refreshments because during the week we had several training sessions, and here this is the chance where we can review together what we learned before. So here, okay, I'll go to the system, to clinical information system, and by the way, as per the privileges, no need for doctors or users to see all those functions all together, which means through the Certacure control here, we can custom tailor the privileges for certain role or certain users, what to see, what not to see, as per the hospital policy and procedure. In physician's case, for example, no need for them to see Certacure control, neither patient administration, even the billing services, all right, or the audit, all right. We can remove them, all right, and keep only their part, I mean. Here, under the clinical information system, also those ancillary systems can be removed. All right, what matters doctors here under the clinical information system is the order management. When I go to order management, all right, here I could have various options. The most important thing, which is the CPOE, which stands for Computerized Physician Order Entry. This function helps doctors to do two functions actually. The first one, which is clinical documentation. The second is the clinical ordering or service ordering. If I click here, all right, on CPOE, here the system gives me my main board, all right, and as you see, we have the search engine where I can search for a patient by name, whether in Arabic or English, medical record number, the number which is generated during the registration from Certacure system or by telephone. Also here we have the active encounter. We have tabs to show the inpatients under your name, or outpatients, or emergency, or consultations, or patient appointment. If I come here to this icon, which is the advanced filtering, all right, I can, all right, click here. I need to see the active patients only. So any active booked or has a visit with a doctor for today's date, all right, as active, all right, will be showing for a doctor. The system filters per doctor, by the way, which means if we have a doctor for specialty or certain specialty, the system filters automatically his or her patients for the three areas: ER, outpatient, and inpatient. All right, because here I'm not a physician, so I don't have any patient, therefore I can't see anything. If I am interested to see all the patients, okay, whether they are currently active in the hospital or out of the hospital, I can mark all patients and search, all right, the search engine here. All right, then the system should show those patients. Here I can go back, all right, I can select by today's date, for example. Okay, if I clicked here, clear, and search, okay, we're supposed to see our patients here. Like this. Now, the second thing, as we discussed before, this is the inpatient. You can see your admitted patients here. Also, we have the outpatients, we have the emergency patients, consultations, and appointments. Now, for the outpatients, for example, here, this is the main board, we call it, or electronic medical record. Another thing, we have the status, incomplete or completed. This is doesn't stop doctors, but this is an indication for doctors to complete the medical chart as per criteria given by the hospital or the quality department. For example, we say in order to consider the outpatient chart is a completed chart in terms of documentation, doctors, for example, have to fill the chief complaint, for example, the diagnosis, initial assessment form, and they can do physician assessment, etc. So the system understands, all right, this patient is still incomplete because one of those criteria is not captured yet by physicians. Here we have patient's information: name, medical record number, gender, date of birth, also the doctor, the location or clinic, the visit date and time. Also here we have sort like arrows where I can sort ascending or descending in order to see the specialties here, ascending or descending. Also here we have some icons like infectious, if the infection captured will be turned on, all right, or highlighted in different color. Allergies, diagnoses, pain or severity, also lab, also panic, lab panic. We have pain score, and also the wallet here shows the patient's type, whether he's or she's cash or insured patient, and also the EMR. Also here, if among these patients, I can look for certain patient low than, then the system filters the registered patients, or I can look here, okay, by, as I said, name or MRN or telephone number. Okay, going back to advanced, okay, filtering. I am not interested to see any other patients rather than my specialty, so therefore I can here filter for my specialty, Ops Gynae, for example. When I select Ops Gynae, even the encounter date, I can select it for today's date. Discharge date within, I can filter from to the medical record or phone number, then I can search. You see this, the list narrowed down to show only my specialty instead of seeing all specialties across the hospital. Thank you for watching.